Well, hello, everybody. Thanks so much for joining us again today. This is our second seminar in the series, and I'm delighted to join you again. You know, last week we started to unpack what does a job really mean to an individual, to a family, to a community. And we said as a group that it can mean financial stability, personal dignity, self-determination, hope. And in aggregate, that it means a stronger and brighter and healthier society. So to briefly recap what we talked about last week and to jumpstart today's conversation, maybe you could put in the chat other reasons besides a paycheck that somebody might choose a particular job or career. So other reasons besides a paycheck, you might choose a job or career. I'd love to get some of your ideas here, see if we can get the mojo going here a little bit. So it's in the afternoon, it's gray, so we should bring our own energy today, I think. So going back here, I think one aspect when we think about what a job means to society, when we think about what a job means to a community, health might not first pop up to mind. It might not be the first thing that you would have jumped into the chat to think about, right? For many, a job means access to healthcare and peace of mind, but it wasn't always that way. In fact, healthcare, as many of us know it and receive it today, was born out of a private sector innovation. So during World War II, when so many working age Americans were diverted to military service, America faced a huge labor shortage. Economists feared that we would experience really crippling inflation if businesses engaged in a bidding war for talent. And so to combat that threat, President Roosevelt signed an executive order that froze wages. So imagine you're living in this time and there's a labor shortage, but wages are frozen so that there isn't competition for talent through that. So businesses still wanted to find ways to attract top talent, and they started offering benefits as a result. So they found non-salary, non-wage incentives, and namely it was health insurance. So as a result, the percentage of Americans with health insurance went from less than 10% in 1940 to more than 50% in 1950. Imagine that. Fewer than 10% of Americans had health insurance in 1940. So today, more than 180 million families and retirees benefit from employer-sponsored health insurance, and an overwhelming majority of those people, 86%, say they're satisfied with their coverage. Healthcare has and will always be a core business issue, and the link between employment and public health spans all the way through our society. For example, areas with high employment rates have higher life expectancy, lower chronic illness rates than areas of high unemployment. In addition, they have greater access, as you might logically conclude, to healthy food. They have fewer barriers to health services and more. We know that education and employment are critical social determinants of health, which, as you know, is a burgeoning field in the United States right now. But it's part of why premature death is twice as high in Prince George's County, Maryland, than Fairfax County, Virginia, despite the fact that they're only separated by the Potomac. So employment alone cannot solve the extent of the healthcare challenges that Americans face, but it is a good place to start. In addition to that, healthcare is its own industry, of course. The healthcare industry is the fastest growing sector of the US economy, employing more than 18 million people. In fact, the healthcare sector is now the leading source of US jobs, overtaking manufacturing and retail. Job growth in healthcare is expected to continue to outpace all the other sectors. And of course, that's only been accelerated by the demand for health workers in the wake of COVID-19. Each one of those jobs has compounding effects on our society, whether serving the most at risk, assisting with mental health support, or providing treatment for diseases of today, or importantly, developing the cures for diseases of tomorrow. These jobs also mean greater purpose, enriched self-fulfillment, and a stronger, healthier commitment. One might ask, what's the private sector's role in all of this? And I think we've been reminded over the past 10 months how critical the private sector is to our public health. Maybe you could think about this. Enter into the chat or into your own mind's eye some notable private sector names you've heard associated with public health over the past year. So over the past year, numbers of private sector companies have been associated with public health. A lot of these businesses have traditionally been associated with healthcare, but some of the very important key players in our nation's response to COVID-19 have usually operated or traditionally operated in entirely different industries. So of course, we saw at the beginning of the pandemic, hospitals and healthcare professionals really stepping up to a mysterious pandemic that nobody knew how to treat, that was dangerous to themselves, just when our country needed them the most. But we also saw private sector companies outside of healthcare step up. We saw a lot of companies kind of answer the nation's call, right? And those included companies like 3M that started running plants 24/7, manufacturing 2 billion respirators in 2020 and continuing to produce 95 million N95 masks per month. I'm sure you all saw the news when GM joined forces with a med tech company, because they were going to alter their production lines to produce ventilators. We saw names like GE, Ford, Cummins, and more leverage and come together to leverage their core competencies to assist on providing equipment, to providing PPE. Of course, advancements driven by the tech sector in addition to this, right? Then you have the tech sector that was allowing telehealth and telemedicine and teledoc so that we could continue to have preventative care outside of COVID-19 from our homes. And of course, maybe what we've all had our hopeful eyes on the most have been the pharmaceutical companies coming together, working together to deliver therapeutics and cures in a whole of industry effort unlike anything we've ever seen. So we saw Pfizer and Moderna have vaccines approved in record time, and we're hopeful that more are on the way from Johnson & Johnson and AstraZeneca and the others that you're hearing about. One of the most interesting parts to me about the private sector role in combating COVID-19 was what companies like FedEx and UPS have done. They started 9 months ago with the very idea that a vaccine was coming in putting together what would the logistics look like, figuring out they're going to need storage of dry ice, figuring out who would take each state, working with governors on logistics really, really early. They decided FedEx would go to the west, UPS would go to the east, and really came together as fierce competitors, came together to figure out how to make this work for our country. We've seen CVS and Walgreens help with testing centers, ramping up to provide vaccinations, particularly in rural areas. And so it's just been a time that when this pandemic that we realize how much we need business. You know, I had the opportunity to speak to the head of production, distribution, supply for Operation Warp Speed in December. And he talked about what the military has been learning from the private sector as they've been partnering in this historic effort. He said, you have to take advantage of what's in place today because the private sector is a tried and true system that works. So we can be optimistic about where we are in this because we're seeing businesses lift us up and move us forward to a healthier, brighter future. That's the power of a job, what it means for your individual wellness, individual health, and our public health. I'm reminded of a conversation I had with Dr. Fauci over the summer when he said, the business community is so essential to everything we do, even our health. To have a healthy community, you must have a healthy business community. It's a truth I'm reminded of every day in my role at the Chamber, and one I hope you'll think more about as a result of today's discussion. So now I'm excited to introduce this week's guest. He is joining us to talk about how these priorities play out day to day in his own job, in his own work. His organization is really leading the way and setting the standard on 3 of the topics that we're focused on: the link between employment and good health, healthcare as a job-creating industry, and the role of business in public health. So please join me in welcoming Hugh Welsh, who is President and General Counsel of DSM North America. Hugh, thank you so much for joining me.
Thank you, Suzanne. I'm looking forward to this.
Well, listen, I'm going to let you talk, but I want to encourage anybody in the audience to put questions in the chat. And when you're finished, I'll roll some of them out for you. So take it away.
Thank you. Well, I mean, just to let everybody know, I've worked my entire career in the private sector. So I don't know so much about policy, so much about politics or academia, but I do know how this plays out every single day in my different businesses. So I have to start a little bit by just explaining who DSM is. I like to affectionately say it's the biggest company that nobody's ever heard of, but I know that you use our products every single day. So we're the world's largest nutrition company. We make all of the letter vitamins you're probably familiar with, lipids, carotenoids, enzymes that go into everything from dietary supplements to food and beverage to animal feed. We also make biomedical materials, engineering plastics, resins, and high tensile strength fibers. And my responsibility is across North America, where we have 38 different sites. And for me, this is both a very topical issue in the context of COVID, but also a very enduring issue in the context of a company that's been around for 116 years. So Suzanne gave a lot of examples as to how the private sector was responding when confronted with the COVID crisis. And we were no different. So our different sites around the country scrambled together all the PPE they had and donated it to their local hospitals, local nurses, local healthcare places. They shut down operations of engineering materials facilities to work with General Motors to produce ventilators, or shut down the production of resins facilities in East Providence, Rhode Island to produce hand sanitizer. And our biomedical facility began to manufacture a PRP device, which you would use to distribute convalescent plasma. But most importantly, on a dime, our nutrition business turned to produce a lot of immunity boosting products like vitamin D and new forms of vitamin D that we're trying to get out today, even in a mass supplementation campaign. These efforts were really very much bottom up from an organization filled with employees who really appreciate their purpose. They weren't top down from me or from the CEO above me. They were from the operators on the shop floor. They were from the folks that work in marketing or finance or communications. And that's something I think that we're particularly proud of, because they saw their responsibility to the community before profitability. And I know the community's appreciated what we've done, and we'll continue to do that going forward. So how does this play out day to day over all these years at DSM? Well, most of our manufacturing facilities are in smaller communities. In many of these cases, we're either the largest or next to the largest employer in those communities. It can be in places like Greenville, North Carolina, Pendergrass, Georgia, Evansville, Indiana, Freeport, Texas. I can go on and on. And our capacity to offer well-paying jobs, stable jobs, jobs with good benefits, has had I think, a material impact on the health of the community beyond just our employees. So how does that work? Well, I like to think that job is therapy. I think if we reflect upon all that we've had to endure during this pandemic, the one thing that I'm thankful for beyond the health of myself, my family, and my employees is that I have a job. I have a purpose every day to get up and to stare at a screen in this case, but to do something meaningful. Ensuring that employees and their families have stable, high-paying jobs gives them purpose, gives them optimism, and helps alleviate some of those diseases of despair. A lot of the opioid crisis is tied to unemployment and those diseases of despair. A lot of mental health issues and depression are all because folks don't have an optimistic outlook. They don't see a positive path forward. And the capacity to have a job, particularly a stable job that pays well with benefits, is incredibly important. So that's what we offer in all these different communities where, I'm from New Jersey. We have a lot of malls in New Jersey. We're familiar with the concept of anchor tenant. We're kind of like the anchor institution in these different communities. We also offer health and wellness programs, which I think more and more companies are exploring. And I've seen some of the data that shows that for every dollar invested in a health and wellness program, you see about a $6 rate of return. And those programs are extended to not just our own employees, but to their families. And what do these programs include? They include tobacco cessation programs. So we'll give employees a discount on their contribution to health insurance if they go through a tobacco cessation plan. They offer, we give everybody little Fitbit-like devices, and they get certain benefits if they can walk their 10,000 steps a day, or if their families can walk 10,000 steps a day. And there's all kinds of competitive programs between sites and within different communities to make that happen. And these programs, I think, become almost infectious in a community. And we try to sponsor as much as we can different initiatives in the communities where we have the privilege to operate. And they seem to have a strong benefit to the overall health. The other thing that we're working very closely on is, being the largest nutrition company in the world comes with a lot of responsibilities. And so we spend a great deal of time going into the community, into schools, into public health arenas with our nutritionists to try to explain, what proper nutrition means, where you can get healthy food. If you don't have access to healthy, whole, fresh food, where you can find supplements or fortified beverages and foods to ensure that you get the nutrition you need. These things we've had a very, very positive feedback on, and we think that this type of education also helps the community make good choices. When I think through all of the different places where we work, I think some of the more profound impacts that we've had on overall community health have been through volunteer programs. So it's not unusual to find a large manufacturer like DSM in these communities also filling out the ranks of the volunteer ambulance squad or the volunteer fire department. In some communities, we've even stood up volunteer fire departments and contributed equipment because we know it's important for our facilities, but it's also important for the community at large. And I'm often struck when I'm traveling around the country and meeting with economic development authorities as to sometimes how they see working with the private sector as almost across this simple two axes. One is will this company bring a tax benefit, and will this company bring increased employment? And I like to think that the benefits we bring are much more dynamic than something like that. They lead to community well-being, community recreation, overall community health, and I would love to see more advocacy around issues like that going forward, because I think it would attract more economic development in these areas and more foreign direct investment. And that's one thing that I feel almost obligated to point out is about 80% of the manufacturing jobs created in the United States over the last 5 years were created by foreign headquartered companies like DSM. And I think you'll find, particularly in the European headquartered companies, that the level of commitment to the community is just as great as the level of commitment to say, shareholder or customer. And so to the extent that we can have policy incentives to attract that foreign direct investment, to improve community development, manufacturing development, particularly in rural areas, I think would go a long way, again, not just to raising tax revenue and creating jobs, but facilitating overall community wellness and health. And so, Suzanne, I could go on all day anecdotally with stories, but I can tell you that at the end of the day, when I'm done and retire in 70 years because of all the nutrition that I get to take, one of the things that I will be most proud of is the impact that we've been able to make in so many people's lives beyond just those that have worked for DSM, by supporting communities, allowing generations to come through the different facilities that we have operating, to keep communities together, which is in these rural communities a major challenge as opportunities dry up, the younger people leaving behind retirees and elderly who then suffer from tremendous social isolation, which is also adverse to community health. So I will feel most proud of the capacity that we had to change people's lives, to keep communities whole, to improve community health. And I'm very interested in learning more and hearing some suggestions as to what we can do better. Because the one thing we know for sure, and certainly what we've learned over the course of particularly the last 11 months, is that you have to expect the unexpected. We live in a VUCA world. And to the extent that we can build a more resilient company, thereby creating more resilient communities, I think that we can create a foundation for public health, not just today, but for generations to come. Thank you.
Oh, that was great. I could have listened to you for a lot longer. So thank you for that, Hugh. I'm going to lift way up for just a second and ask you this question, which is, sometimes, or too often maybe, capitalism is thought of as a dirty word. Profit is a dirty word. And so you've talked about purpose, you've talked about meaning in your work, meaning in what DSM does. How do these two goals, kind of profit and purpose, fuel each other or combine together?
Yeah, I mean, the slogan for our company is purpose-led, performance-driven. And we know that if we're not profitable, we're not sustainable. And if we're not sustainable, we're not going to be able to contribute our purpose to the larger community. And so, we don't see profit as a dirty word. We see profit as delivering a return to our shareholders as extremely important. It's something we focus on every day. But we see equally important taking care of our employees, ensuring that our customers' needs are met, and making sure that we contribute to the communities where we have the privilege to live and work, as well as to the larger society. And some of that is not just CSR kind of talk. I mean, business can't succeed in a society that fails. And so, if we are not meaningful stakeholders in our communities, in the long run, we will not have sustainable operations. And so all around the world where we make these types of investments, and one anecdote would be in Kigali, Rwanda. We do so to help the community, but it has to be a profitable venture, or at the end of the day, what we're offering is maybe a feel-good exercise, a communications opportunity, but really not an enduring benefit. In Africa, in Kigali, there's an issue in the country. There's 36% stunting rate amongst the children. We are the biggest nutrition company in the world. We can help. And what we did is we stood up a new business there called Africa Improved Foods, which produces a nutritious porridge. And that porridge is sold to organizations like the World Food Program, but also on the commercial market. We source all the raw materials for that porridge from local, Rwandan smallholder farmers. So there are now, approximately 20,000 Rwandan farmers who have long-term contracts, who can borrow against those contracts now, who can improve their own productivity, and they provide us with the raw materials we need to produce the porridge in a plant that employs 500 other people. Already in 2 years' time, we've seen a material increase in agricultural production in Rwanda as a consequence, a material reduction in stunting amongst children, and the business is profitable. I use that because it's an easily explainable example of how the private sector can come in and create a really dynamic, positive impact on the community beyond just providing a tax revenue base and jobs.
We're getting some questions from the students I want to, or the audience that I want to jump into, but let me ask one quick follow-up question, which is, I think sometimes one of the questions we hear from students, not necessarily at AU, but generally at the chamber is, but couldn't the government do the same things? Like, why does the private sector have to do the things that you're suggesting here? Why not the government?
In my experience, the private sector demonstrates a much more innovative and creative mindset, is certainly more agile and adaptable to the changing needs of not just the community, but the world. And as a consequence, is best positioned to deploy capital in the most efficient way to deliver a result in the fastest way possible. And I think, again, referring back to the pandemic that we're all living through, that bore out tremendously. Operation Warp Speed is a perfect example of government enabling the private sector to unleash that creativity, that innovation, that imagination to deliver something in a record period of time under adverse circumstances.
Yeah, I think I couldn't have said that better myself. I think that's really true. And getting to one of the questions here from Isabella, she says, and I think this is related, what would you say is the most important aspect when bringing together the private and public sectors in order to come up with solutions for public health problems or priorities such as COVID?
One, of course, trust is required at all times. And I can tell you, I've been at this in DSM for 20 years, working quite a bit with governments around the world, as well as organizations like the UN. And trust is not a given. There's a lot of, I think, apprehension on both sides as to what expectations are, and that has to be addressed up front. The other is to be outcome focused. Many times I think governments and NGOs see the private sector as a philanthropic well to go to find funding to run their projects. We see public-private partnership as a necessity to sort of tackle some of the world's biggest challenges, but it's got to be a partnership in the truest sense, where the private sector really should be expected to bring to the table more than just money or materials, to bring know-how. And I have lots of examples of how the private sector has come together to deliver know-how to different communities, different parts of the world, that it creates much more enduring value over time than a simple philanthropic donation of money or material.
So here's a question from Tony Hollinger, which clearly shows a business mind here. So has the fact that your company is non-US headquartered been a net benefit or challenge for your North America operations?
I got to make sure there's nobody in our headquarters on this call, but I'd say it's been a little bit of both. So it's certainly been a benefit when it comes to, for lack of a better phrase, reimagining capitalism a bit, where we're a publicly traded company on the Amsterdam Stock Exchange, Dutch-based, and in the Netherlands they don't have Delaware corporate law. Right? So they don't have the traditional sole and exclusive fiduciary duty running to the shareholder. They have a much more stakeholder capitalist view of the world, which gives us a little more runway to run some of these projects like in Africa Improved Foods or Partners in Food Solutions and things like that without facing the pressures that I think an American publicly traded company might feel when it feels as though it's got to run its business on a quarter-to-quarter basis. At the same time, it becomes a bit of a challenge because, out of sight, out of mind. And that, we can bring to the table, I think, a whole host of solutions and especially innovation and ideation and creativity that you can find in the United States of America, like you can find nowhere else in the world. And you can try to bring that to a European mindset, which tends to be a little more transactional, a little more pragmatic, a little more risk averse. And for them, it could look as though, the American leadership are crazy Wild West. And we can look to them like a little bit of the old world. We got to move faster and more creatively and more risk tolerance. So there are both, as in all things, I think, there are both benefits and there are challenges that come with being the head of a North American operation of a European headquartered company.
America as a teenager and Europe as a parent. So Connor is asking an interesting question here that might end our segment. That I think I'd love to hear what you think about this, which is, what is a misconception about the private sector that you would love to clear up? If people here that watch this live, that watch it later, what do you want them? What's something you would clear up if you could about the private sector?
That folks who run large private sector companies only care about money. I think that to a CEO that you interview across any industry segment, any product market segment, when you talk to them about what drives them every day, why they do what they do, I think that most students, most folks who would ask, assume that they want to get rich. It's about money. It's about delivering for the shareholders. And to a person, you would find that it's the higher purpose of the organization that they have the privilege to lead that drives them every day. It's if they're in the healthcare sector, it's taking care of patients. And they're authentic and sincere about that. If they're in the nutrition sector, it's keeping people healthy. If they're in the automobile sector, it's producing a high quality, safe, efficient car. I think that's one of the biggest misconceptions, is that we do what we do for money, when at the end of the day, we really do what we do because we can care sincerely about the products we produce, the services we deliver, and at the end of the day, the consumers who have access to them all.
I think that's so important, and I'm hoping is an underlying theme of this seminar. So you're the third executive that we've had share the screen, and the third person, I think, where their authenticity about purpose really comes through. So I'm hopeful that everyone in the audience and everyone who watches this later will be just as convinced of that as I am. I've seen it in you throughout your career, and I'm really appreciative of your partnership with the Chamber and your willingness to take time today. So thank you very much, Hugh.
Thank you. Thank you for the opportunity.
Yeah, absolutely. Okay, so next up, we're delighted to be joined by the U.S. Chamber's senior economist, Curtis Dubé. He's going to help us think about some of the ideas we've been talking about with a real, harder look at healthcare through an economics lens. So thank you so much, Curtis, for taking time to do this, and the floor is yours.
Glad to be here. Thanks for asking me to join you. So before I get into the impacts of COVID-19 on the economy, I want to touch on something that is really interesting when it comes to healthcare, and for any of you who have taken an economics course before, one of the first things that you would learn in an introductory economics course is the difference between the definition of a normal good. And what a normal good is something that all of us spend more on as we have more income, and we don't tend to think of healthcare as a product or a good or a service. We think of it as something separate because it is so vital and important to our well-being. But it is, at the end of the day, at its very core, it is a good and service that we purchase like any other good and service. And as we have gotten richer as a society, as a country, we have spent more and more our income on healthcare. And it makes sense. As our standard of living has improved, we want to spend more on our health and our well-being. So we've been devoting more and more to that. And as we've done that, that has increased the demand for healthcare. So there's a lot of talk about how healthcare is so overpriced here in the US, and it certainly is. There's no doubt about that. And I don't want to get too deep into a discussion of what drives the cost of healthcare, but it's important to remember that one of the reasons that it's going up, and it's been going up for years, is because we are demanding so much more of it. We have more income. Our income as a nation has grown tremendously over a long period of time, and as our income has gone up, we have spent more and more on healthcare. And it is a facet, and it's something that developed countries do. They end up spending more of their income as they grow on healthcare. And as we've done that, and for other reasons, life expectancy has grown. And as life expectancy is growing, we are spending more for longer periods of life. And it turns out that as we get to higher and higher ages, the healthcare that we demand is more and more expensive. And those factors help explain why the cost of healthcare has continued. It's one of the reasons that explains why the cost of healthcare has grown so much over time. So it's a good thing. We want to have a growing economy so that we have the resources to expend on healthcare, because it's good. It's good for us to live longer. It's good to have better standards of living while we are living. But it does have this problem of driving up cost over time. That will eventually, something will happen that will bring it down. One of the drivers of healthcare cost at the end as we get older are, I think it's like 3 or 4 major illnesses. So heart disease, Alzheimer's, cancer, diabetes, and I'm missing one other one. But those are the main drivers. Someday, probably not in my lifetime, but sometime in the not too distant future, we'll probably solve all those things, and we'll shift on to another set of health expenditures that are just as expensive to treat as we live even longer than we do now. But that's something to look forward to, because again, we will extend our life expectancies, and we will be healthier as we live out those years. So again, it's really vital, though, to have a strong economy so that we can continue to devote so much to healthcare. Because again, countries that are not as developed cannot spend as much on healthcare, and their healthcare outcomes are not as good as ours. Now, again, there are better. The U.S. system has issues and problems. I'm not defending the whole system in total, but it is helpful to have so many resources to devote to healthcare, because it does, in general, result in a better standard of care and better standard of healthcare. So with that, I do want to hit on the current situation, because this is incredibly unique. We haven't really had a period like this where the health of the nation is dictating the economic outcomes. Usually when you have a very severe economic event like we've gone through, it happens what economists call endogenously. Endogenous means within, so within the economy. So if you remember back to the Great Recession from 2007 and 2009, that occurred because of a financial crisis that was triggered by a housing bubble. And that spilled over into other areas of the economy, and we had a very deep and prolonged recession. Again, that happened within the economy. That's fairly normal to have an event like that leads to a contraction. This is totally different. The economy was doing really well right up until the middle of March, and then you have a virus that imposed its will on the U.S. economy and the global economy, and the virus is restraining. It's keeping the economy from growing as fast as it could and as fast as it should, and we will remain in that situation until we can get fully past the virus. The vaccine is really, really important when it comes to that. This is what economists call an exogenous shock to the economy, and it's very rare. The last couple of recessions, if you go back, so 2001 was caused by the bursting of the dot-com bubble. The recession before that in the early 90s, that one was just a business cycle one, but the one before that in the late 80s was caused by the SNL crisis. The one before that was caused by inflation and other issues in the early 80s. And you go back and back further, they're usually happening within the economy. Interestingly, though, the biggest quarterly contraction we ever had on record is now the second quarter of 2020, when the economy dropped by more than 31% on a quarterly basis. The biggest contraction before that was in 1958 for one quarter, was a 10% contraction because of the flu pandemic that year. So we do have some experience with big economic hits because of a virus. It just didn't last as long. I'm not even sure if it was a full recession. You have to have 2 quarters of consecutive growth to have a recession, but this one was a heck of a lot bigger. And so I do have some charts that will show you just how in control of the economy the virus is. And again, very unique for health to be a health issue to be constraining the economy. So I'm going to go ahead and share my screen with you. Hopefully you are seeing a chart. This is consumer sentiment. And what consumer sentiment is, so the University of Michigan surveys consumers a couple times a month, and they've done this every month for years. And they ask them how they're feeling about the economy, how they feel about the economy will be in 6 months, in a year, and they develop a consumer sentiment chart. As I said, the economy was doing really well in February of 2020. It was actually at record highs for things like consumer sentiment. So we were doing really well. Wages were going very strongly for those at the bottom of the income scales, which was something we'd wanted for a really long time and hadn't been able to get there. And we finally were getting there at the beginning of 2020. And the virus wiped that all away, unfortunately, which is really unfortunate, but it's just the reality of what's happened. But so I wanted to follow the path of here, as you can see. So we fell way down from the survey. The index was at 101 in February, falls sharply in March. Remember, the virus didn't really hit here. I always date it to March 13th, 2020, because that was the last day I was in person at the US Chamber, and it was the last day my children went to school. So that will always, to me, be the beginning of the pandemic. So even in the middle of March, the economy was doing pretty well. But then we go into kind of a nationwide lockdown where we shut down the big parts of the economy. So only for 2 weeks in March, the sentiment drops. We have the full month of April in that kind of lockdown and into late May. And you can see that sentiment really drops off, goes all the way down to just below 72, stays there in May. Now, if you remember back, so the virus is really bad, really raging in April and May. But then in May and early June, it started to recede. It looked like we were turning the corner. And you can see sentiment picks up. Oh, and by the way, I should point out that sentiment matters because people spend more when they are feeling strongly and they feel good about the economy. And they spend more, the better they feel. And when they spend more, that drives growth. It's very highly correlated with the health of the economy. So we want to see strong consumer sentiment. So the sentiment picks up in June as we start to think we're turning this corner. We're going to get past this virus. But if you remember, you get into late June and July, we get the surge in the south and in the western parts of the country, and sentiment drops right back down again in July. That goes on for about 6 weeks. We get into the middle of August, and people are starting to feel better again. We're going to get to the fall. The virus has hit all the different parts of the country, so we're in good shape. We're going to be past this. Sentiment rises pretty sharply in September. Really sharp increase. I think that's the biggest increase during the pandemic. Stays elevated in October. Things are going well. Haven't had a surge. Maybe we're past this thing. Then we get to the middle of November, and we have the surge that we've been dealing with ever since. Really steep drop in November. Good bounce back in December, and then another decline in January. So you can see the virus really strongly dictates what's going on in the economy, and this follows for all sorts of things too. So it's not just consumer sentiment; it's things like the jobs outlook, or the job situation. So we lost over 20 million jobs, over 22 million jobs between March and April. So we had over 152 million jobs in the economy in February of 2020, as you can see on the left side of the chart. And then we lost 22 million over 22 million in April. We got huge numbers of jobs created as things started to, as the virus receded. So we got big job creation in May, big job creation in June, big job creation in July. But ever since August, September, October, November, it slowed substantially as the virus came back. And we actually had a negative number in December because of the virus. What happens when the virus surges is two things. One is that people naturally stop going out and spending as much as they otherwise would, and that reduces economic activity. But then you get the reimposition of government regulations that close things like bars and restaurants, and that of course is going to have a negative impact as well. So you can see it show up in the jobs data as well. I just want to show you one other thing. So income has been bouncing around as you would expect to. It follows somewhat the same pattern, but this is really interesting. Again, this is a very different type of recession that we're dealing with. Income is higher right now than it was before the pandemic. Remember, I said the economy was in really good shape back in February, but income is now higher. Income should fall during a recession. People lose their jobs, businesses aren't making as much. You would think that incomes would be less, but they're actually elevated right now. And that's probably going to remain for January. And this is the effect of government assistance. This is the pandemic relief payments, the checks that went out now in two rounds, might be coming again. It's the impact of extra unemployment benefits that were in place through the end of July, and then partially in place for up until December, and now have been put back fully in place at the federal level. This is a federal plus up on a weekly basis. Those really put, and there's actually provider payments. There are federal government payments to medical providers who treat COVID patients. That's boosting incomes as well. So it's a very unique situation. This is you don't usually have we're not in a recession anymore. The economy's been growing since the middle of 2020, since the end of the second quarter, and it's been growing fairly well. But usually, even in the aftermath of a recession, incomes are weaker. It takes a while to repair them, but we are not in that situation. Incomes are now higher than they were, and that's a really good thing, because people have the money they need to sustain themselves as we weather out the end of the pandemic. They've also been saving a heck of a lot more. Another really interesting thing. Usually during recession, you'd be spending down your savings, and you spending everything you have and spending down your savings because you're trying to make ends meet while times are tough. Pandemic's been a little different. You've had the boost in income that's come from government support, and a lot of people going back to work. I should have added that. So you have the government support and the incomes rising, or incomes from people going back to work. So that's boosted savings. But nobody, no matter if you're getting government assistance or you've been working, you just can't spend the same way. And it really comes down to spending on services. We can't spend on bars and restaurants, events. You can't go to sporting events, theater, movies, travel, tourism, accommodation, all those things that consume a good chunk of our spending. You just can't do it. So we're not spending on those things, and we're saving a lot of that money that we otherwise would have been spending. So that's going to be in people's checking accounts, ready to be spent once we can get back to those activities. And so that's one of the reasons why economists, analysts, including me, are very bullish, very excited for where the economy will go at the end of this year, assuming vaccines continue to roll out and we see vaccine levels continue, or vaccines get out and we see virus levels continue to fall pretty sharply. So I think that's pretty much as far as I want to go today. I can get into lots of different areas that you're interested in question and answers, but I'll just double check. Yeah, I think that's good in terms of the data points that really show what the virus has done to economic activity.
Curtis, thank you so much. And we do have a couple audience questions here. Let me ask the first one. How do you think this feeling of economic uncertainty will affect consumer behavior in the economy in the long run?
Well, I think consumer sentiment turns around really, really fast. It can go from really high to really low, as we saw in that chart, and it can do the opposite. And I think it will do the opposite. I think that when people can start going out of their houses and see, they can go do the things that they were accustomed to doing and have been wanting to do so badly for so many months now, when they can get together with friends and family in ways that they couldn't before, when they can travel and do things that they've been prevented from doing. I think they'll do so in a really big way, and I think sentiment will really jump up high. And what will really help that again is that the income and savings data that they have there, they have in general. So I've given this presentation in lots of different areas, different places, and every once in a while people will point out that, who are you talking about? I know so many people who are struggling. These are aggregate numbers, and it's always the case with macroeconomic data. So when things are bad, not everyone's doing bad. When things are good, not everyone's doing good. And I understand we're still in a severe pandemic, and that it's having a real big negative economic impact on lots of people. But in aggregate, there's a lot of income and a lot of savings built up that will boost spending once we can operate more fully. So once that happens, I think you'll see a big rush of spending, and I think you'll see a big surge in sentiment. In the long run, past the end of the year, who knows? That sentiment is very fickle. Isn't probably the right word, but it's the word that came into my head. If you can go to the University of Michigan, just Google it and say University of Michigan consumer sentiment. They do a little bit of a short blurb every month to explain what's going on with their consumer sentiment numbers, and they've bounced around a little bit, like you saw. But one of the things that's been driving it, other than what people are feeling about the economy, is the election results. So Republicans, and they've never seen this before. It speaks to the politicization of so much of our society today. The election results, Republicans were bullish on the economy into early November, and it fell off the cliff. Democrats were the exact opposite. They didn't think the economy was very good, and then as of November 7th or whatever, their sentiment shot up. So a lot of things impact that, and a lot of things can, other than politics, will influence it going forward. But between now and the end of the year, I think things will be pretty good.
I think you make a really good point, I think, about pent-up demand, right? So, but let me turn back to the topic of today, which is really health. Here's a question from the audience. How can the private sector help fill in the gaps? And maybe I'm worried that this could have been a question for the last speaker now that I'm looking at this, but I think it's important and I think you might be able to answer it. So Curtis, I'm going to give you one. We're talking about accessibility to health services, right? So we talked in my opening, we talked a little bit about how you can have communities next door to each other with really different health outcomes, right? So starting with that concept, and then I'm going to get into how the private sector might help, but start with, how does that happen where you have communities right next door to each other with really different health outcomes? What's the economic purpose behind that?
Right, and so I think you hit on it exactly. So you have places where there's high levels of income and wealth tend to be highly unequal. Inequality is high in places where income and wealth is concentrated. So think about just here, just the counties you pointed out are great examples. So there's high income in parts of DC and the surrounding areas, and there's low incomes and low wealth right around here as well. That applies in New York City, it applies in San Francisco, it applies in LA, in Chicago, and all the major areas, Seattle, areas of highly concentrated wealth and incomes. And so the people who are lucky enough to be of high income and high wealth, their health outcomes are much better. Because they have the money, like I talked about at the beginning, they have the money to spend on healthcare, and they seek it out. And they have, this is something that we talk a lot, my wife and I talk a lot about, is that people with higher incomes tend to have more flexible jobs too. So we talked about this in terms of the pandemic. We've both been working from home since March. We're very lucky. We couldn't have carried this on because our kids are here. We have 3 of them. We couldn't do this if one of us had to go to work. One of us had to left the workforce. And when we have something going on with health, all my doctors are having me right next to the Chamber of Commerce. I just scoot over. When I have a dentist appointment or my annual checkup or my asthma or allergies flare up, they're right there. I just walk over for 45 minutes and then go back to work. It's not an issue. Or my kids are sick, I just take them to the pediatrician and just go do it and then swing them back to school.
But
same with my wife. That is not.
How do you deal? I'm sorry to interrupt you, but there's a fundamental inequity, right, where you have an accident of birth kind of determining health outcome. You're born into a lower educated family, or and so I think that this goes to what can the private sector do to help lift people up who are, by an accident of birth, born in a zip code with fewer education opportunities or employment opportunities, or so you get to what is the economic imperative for the private sector to go in and try to change those outcomes? So I know I'm getting outside of your field, but I think that's the question. What's the role of the private sector in addressing that?
Right, and so I think there's a lot of different answers, different ways that could go. But again, focusing on the things that they do best. So whatever a company does, and when a company is successful and efficient and productive, it raises all our incomes, it raises all our well-being. And as we get better as a richer as an economy, that will raise all boats eventually. And those folks in those areas should end up doing better. It's not a very satisfactory answer. Somebody probably could give a much better answer than that, but that's kind of what the macroeconomic answer would be. I do want to point out that the public sector can do a lot. I mean, the private sector can do a lot, but healthcare is really hard. So Amazon, Berkshire Hathaway, and JP Morgan, they teamed together to fix healthcare, right? They were going to come together and they were going to fix this because all these health insurance and healthcare companies that have been doing this for years just aren't doing it right. They gave up. They pulled the plug. They started like 2 years ago, and they pulled the plug a couple of weeks ago and said, well, we're not going to try this anymore. Healthcare is really, really hard. And so it's not going to be something that's fixed overnight. One other way is that innovation. That's probably the best answer I can give, is that somebody who comes from the total left field and says, I know how to fix this, and decides to put resources into it, they're the ones who are most likely to solve it.
And I think, Curtis, what's interesting about that, right, is I think another thing that a lot of companies are starting to talk about is, do you have more than a pure economic imperative to choose where you locate? So if we know that jobs are correlated to higher health outcomes, the reduction of food deserts, the increase in health benefits, the increase in preventive medicine, the increase of flexible schedules to allow you to exercise and participate in preventive medicine, then we're seeing at the chamber, this isn't a question as much as a comment, but we're seeing a number of companies now say, do I have a reason beyond pure economics about where I locate? And how do I think about providing opportunity in places so that the country does better as a whole? Because I think what we're trying to talk about in this seminar is that it really is an ecosystem. And so if you are a consumer products company, you need consumers to have money to buy your stuff, right? So at a pure P&L motivation, you care about people doing better over time and having more discretionary spending over time, right? Let alone, as Hugh just said, that you're a human being and you care about what happens. So it'll be interesting to see if companies can figure out less traditional ways of figuring out where to locate. We talked about that with Mike Neal, whom you know, at the Tulsa Chamber last week, which was really about how do you draw jobs to Tulsa? And what does it mean to Tulsa when that happens? And so I do think part of the goal of this seminar, and maybe you could comment on this, is sometimes you read in the paper that your city or your state offered huge economic incentives to locate jobs there. And you think, oh my gosh, this is just the rich getting richer. They just gave all of these incentives to this big company. But I think that the reason that states make those choices is because they know what happens to everybody when jobs move into their state. And so have you done much thinking about that, about the economic incentives that states or cities offer to get companies to move there?
Yeah, I used to do a lot of work on that. But on a higher level, I do think companies are now thinking more about their social responsibility. It's a big change, and it's happening fairly rapidly. If any of you have done any reading in the free market economics world, this is the Milton Friedman thing, that the number one objective of a business is to make money for its shareholders, and everything else is subservient to that. And if there are other outside goals, so like the Whole Foods example was the original example of they donated so much percentage of their profits to a charity. I forget what it was, but the point was, and Milton Friedman would point back and say, yeah, but that's what their shareholders and their customers want. So it is subservient to shareholder value. But I think this has really changed in a big way in the last few years, and I think there's a definite acknowledgement of more stakeholder capitalism, a term we heard earlier. I think it really is taking hold. But so states and localities know that this matters a great deal. I said you should do a lot of work on state competition on tax policy, and they compete enormously over it. So I used to, for a small think tank called the Tax Foundation, I used to compile data on state by state taxes, and they would call. Like, oh, we're going to put out these, they knew the publication was coming. They'd call and say, where are we going to be? And why are we there? Why is Georgia not above South Carolina? How could that possibly be? And we have to be above Tennessee. This is way better. Your numbers are not right because we're way better than Tennessee.
And why
And so
did
they're
they
very
care?
sensitive to it.
Why did they care? Why were they lobbying you about that?
Oh, because it's a selling point. So the governor will go out, or the mayor, and go out and say, well, look, based on this ranking, this is the best place for you to locate. Where it gets tricky is when they start adding incentives, extra incentives, right? So when they'll say, I used to have a whole file of a notebook of them. The best example recently is Foxconn in Wisconsin.
Yeah.
The deal that was cut there for Foxconn to come to Wisconsin, but there's so many of them that have gone on, but it gets dicey. Like you're paying the company to come. Do they stay for the long haul? Usually the best way to compete is to have a very good tax system, keep it consistent for everyone, and let them come to you. And it becomes very politicized. If you remember what happened with Amazon, the 2 new headquarters, there's going to go to New York City and to here in Arlington. They're not going to New York City. You can look that story up because it becomes highly charged. But that's the value that the governors and mayors value it so highly because it matters so much. Those jobs are really important for those communities.
And we know what happens in South Arlington to have Amazon move in there and pay those real estate taxes there and other taxes there to go right into the education system. So we know what happens and the full system of it. Well, anyway, Curtis, you're so nice to join us. I really appreciate it. Thank you for your insights. And to the audience, thank you so much. It's been just really interesting for me to be thinking about this topic, particularly when we're under this pandemic and the line between public health and the economy has been so stark, as Curtis said, more than ever before. So really appreciative of your time. Thank you to all the students who have been helping behind the scenes. Please give them a whole bunch of feedback on how we can make these more interesting to you and more helpful to you. We will be back on February 18th, where we're going to talk about the link between employment and the environment. And I think it'll be really interesting. And we will again have some major corporate leaders for you to hear from. And I'm looking forward to seeing you then. Thank you so much.